Welcome to Global Health TV and our very special show directly from the American Psychiatric Association meeting in New Orleans. On today's show, we talk to leading psychiatrists about challenges in the treatment of traumatized refugees. According to the UN Refugee Agency, in the first half of 2021, more than 84 million individuals were forcibly displaced worldwide as a result of persecution, conflict, violence, or human rights violations. This includes 26.6 million refugees, the highest ever seen. A special group of refugees are asylum seekers who arrive in a country seeking safety, who then apply for protection. Most asylum seekers, as well as a high proportion of refugees, have had severe traumatic experiences. To learn more on the issue earlier, I sat down with psychiatrist Dr. George Keepers. So as far as I understand, the UNHCR says that there are 100 million people around the world who are involuntarily displaced. And obviously we've got our pictures on our television set every day from the Ukraine, and I think the figures there are something like 4 million people, again, have been forcibly displaced. Now, clearly not all those people are refugees, but it gives some idea, doesn't it, about the size of the global problem we have here.
Yes, it's a huge problem, and the number of refugees has been growing dramatically over the last decade or so. In 2018, I think it was something like 80 million, now 100 million, as you described. Those probably does not count the displaced people from the Ukraine at this point. So it's a dramatic and growing worldwide problem.
Give me some idea, if you will, about some of the distress, some of the stresses, conditions that refugees, displaced people will suffer from.
There's a multitude of problems that displaced people face. Of course, they are often traumatized and often suffer from the effects of the displacing agent, whether it's war or some other cause. Frequently they have psychiatric conditions, PTSD in particular. But in addition to that, they are displaced to a culture that is not their own, often into a situation where they do not speak the language, usually without adequate socioeconomic supports on their part. So they are in very difficult situations and require a great deal of help to succeed as displaced persons. The capacity of our world, of our nations to provide that kind of help is limited, as we are seeing in the current crisis from Ukraine.
So what's the role of the psychiatrist?
So psychiatrists have a variety of roles in this kind of disaster that we're experiencing worldwide. Certainly the treatment of psychiatric conditions is one of those, and for many of the people who are displaced, they will have psychiatric conditions that psychiatrists are very accustomed to treating. So they may suffer from schizophrenia, from serious depression, and other illnesses that psychiatrists have the expertise to help. They also, as I mentioned, frequently suffer from post-traumatic stress disorder. And that's a little bit more complicated problem in a refugee population, because the treatments that we have in the United States that we have verified as evidence-based, there's considerable question about whether or not they really apply to refugee and traumatized populations from other areas. We have a variety of treatments like prolonged exposure therapy that have been verified to work in our own people, in victims of war trauma and so on. But there are not just hints, but studies, a Cochrane study that demonstrated that these kinds of treatments don't necessarily work for people from other cultures. And in addition to that, there's a hint in the data that they may actually make them worse.
Talk me through the process then. So displaced people arrive, present themselves. Talk me through the process. How does a psychiatrist go about trying to figure out the best course of action?
Well, the first issue, of course, is overcoming any language and cultural barrier, right? And that is often a significant issue for psychiatrists. It is very helpful to have expert translators to help you with this. And what we do in our own program at Oregon Health and Science University is that we have a program that actually incorporates individuals who are from the culture of the refugee into the treatment. So that we have trained them as counselors, in many cases assisted them in getting advanced degrees. They're culturally sophisticated and fluent in the language, and so they can assist the psychiatrist in providing treatment for the patient. That's the ideal way to overcome those first barriers to treatment. But of course, many psychiatrists will not have that kind of help available. But they should be able to get assistance in translation, particularly if they're in any kind of institutional practice. Secondly, evaluating somebody from another culture is an exercise in humility. And so one must adopt that attitude that the patient has to teach you about their story, their culture, the things that they have experienced. A third barrier that I'd speak to is that the stories that these individuals bring to the psychiatrist are often truly horrific. They produce a tremendous emotional response in the people who are treating them as well. It is hard to listen to any of these stories without becoming tearful. And so that emotional impact of the refugee's story is something that the psychiatrist or other treating physicians have to deal with and overcome. You have to understand that there are a limited number of treatments that we have available that are evidence-based for the treatment of PTSD and refugee populations. We're on better ground with treatment of common psychiatric conditions, fortunately, so we can really help there.
What is it that you would like to see? What do you think, as a country, not just America, I guess, but as a society, what is it that we could be doing to improve our dealing with refugees?
So one of the things is the actual admission of refugee populations. In 2015, we were admitting to the limit that we had at that time, which is about 85,000 per year. The very next year, we admitted far fewer than that, and in the subsequent several years, far fewer. We're starting to get the limit back up, but we are not yet admitting many people. We are very good at bringing in folks from other cultures. However, we're not so good at providing the social services that we need, and that's one thing, an additional thing that we need to do. We also need to take the step of incorporating into our medical and psychiatric systems the kinds of interventions and methods that I've described.
Thanks ever so much indeed for talking to us. Really enjoyed it, so thank you very much.
Thank you so much for having me.
If you'd like to hear more on this discussion, then please go to check out the Web's Edge live podcast from the APA, available from wherever you usually get your podcasts. So until next time, it's goodbye.